Much. A breakthrough trial could help us learn much more about beating and also treating Alzheimer's disease.
Joining us now with all the details and how it could help save someone you love from this disease, health anchor Liz Bonus. Liz.
Hey guys, good afternoon once again. This clinical trial explores opening what's called the blood-brain barrier in the fight against Alzheimer's. That's a protective layer in your brain that is very hard to penetrate because it protects us from certain risks, such as infections. But in this breakthrough research at the Ohio State University Wexner Medical Center, they are testing what's sort of a non-invasive surgery or procedure that could help maybe break up in the brain what causes Alzheimer's symptoms, or even give us a new way to deliver Alzheimer's medications through that barrier. And here's how. The surgery takes place in a suite that looks like this one. It's called an intraoperative MRI surgical suite. The patient is awake, alert, and can give real-time feedback. As this video, courtesy of the Ohio State Wexner Medical Center, shows, the team uses imaging guided by the MRI to target specific areas of the brain where there is buildup of toxic proteins. These proteins are thought to cause the symptoms of Alzheimer's disease. They are called amyloids. As you can see, a head frame holds the patient's head in place. It is what's called an ultrasound transducer, and what it really is a helmet with ultrasound beams attached to the frame. Cold water is circulated around the head. This setup helps the team transmit focused ultrasound beams through the skull. It then targets the exact brain tissue needed to cause microbubbles in the blood, which help open up the blood-brain barrier. The hope is that by opening this barrier, the body might clear some of these toxic amyloids. It also might be a way one day to directly infuse medications into the appropriate areas of the brain to halt cognitive decline. So here's the really important part about this. They're still enrolling patients in this trial. So if someone you love is suffering from this disease, we have a phone number for you. It's 614-293-2587. You have to do this 2 or 3 times. So you'd have to be willing to drive to Columbus where that is. But if you have a loved one, even if it couldn't help them, it might help someone else. And the idea maybe is that we'd be able to get medication right where it's needed and slow the progression. So when you saw something really early, to be able to stop or halt that could be amazing.
That would be major.
Yes, yes. And those proteins that they think block us all, you know, they always say what's good for the heart is good for the head, and it's because as we get fat buildup, they build up in the brain. It might even shatter some of those, so we wouldn't have them accumulate. This is stuff that we've never been able to do before. They're starting with the first, dozen patients or so. So if someone you love is there, please call them.
I love that it's happening in Ohio.
I do too. Yeah. You know, I always feel like, and it's a collective effort, but I feel like this is stuff that would lead the rest of the country. Absolutely.
That's great. Thank you.